I certainly say, Madam Speaker, and I think Oregonians will agree with me.
Political bodies exist to secure responsible government and to execute the will of the...
So we're going to be back now with another episode of Oregon D.O.G.E. We're going to talk about DHS, not the Department of Homeland Security. Yes. Here in Oregon, DHS.
Oh, that's what I thought we were talking about.
Is the Department of Human Services. And you serve on the committee.
I do.
In the Senate?
I serve on Human Services, Early Childhood and Behavioral Health, and Healthcare, and those all converge they all interact with DHS.
Absolutely. So Senator Diane Linthicum from the Klamath.
Yes, I
County.
represent Klamath, a portion of Deschutes County and Jackson County, so Southern Oregon for sure.
Awesome.
Southern and Central.
And the unique perspective that Diane brings to this conversation is you were staff for your husband Dennis for 8 years.
Right. Yes.
And now you're a member serving in the committee, and Dennis is your staff.
That's right. Yes, we just switched places. So yeah, he supports me, and I supported him, and so we're in this together. And
our House counterpart tonight, Ed Diehl.
Great to be back. You bet. So I serve on behavioral health and healthcare.
Okay.
And Joint Ways and Means Human Services.
Okay.
And our healthcare committee is the busiest committee in the building, I'm pretty sure.
So in that subcommittee, I mean, you get the full gamut. And so I think we recorded
we did the health
podcast
authority
last week. And if you combine the two, $60 billion plus dollars.
45% of the state budget
between
goes through those two.
Yeah.
Yeah. It goes through that one subcommittee.
So the other half of the healthcare human services is human services tonight. We got Alex Lopez back.
Doge Bros.
I love it. Welcome back. You got some, as always, we got a good slide deck that Alex has helped put together and facilitate a good conversation tonight.
Yes.
Get us going.
Well, I got to do it to you. Your favorite game. Where does Oregon rank? We're doing it. So it's fun. Mm-hmm. It's fun.
Fun and depressing. I can tell already.
Fun and depressing, right? The rules of this game, we're going to have 3 questions. It's kind of like a pop quiz, but, I'll just flash these questions and please just think of the answers. Don't shout them out. And 1 being the best and 50th being the worst is the skill that we're
don't
on
shout
today.
them out.
So
there's a contest. So we'll make eye contact and we'll...
Yeah.
When we lock in our answers.
Go down in the line. So the first question is, where does Oregon rank for providing adequate treatment for illicit drug use disorders?
Out of 50 states.
Out of 50 states.
You locked in? Are you locked in? You know your answer?
I know my answer. Well, I don't know if it's true, but...
Rep Diehl, get us going.
I think we're near the bottom, if not the bottom. I'm saying we're 48th.
Okay, 48th.
50th.
Okay.
And 49th.
Okay. Well, Senator Linthicum, right on the money, 50th.
50th.
Oh, jeez.
50th.
I was optimistic. We were both optimistic.
And that's per addictiongroup.org. I don't think any
the hard
of us
part
are
with
shocked.
that, though, is like when people passed ballot measure 110, which sometimes they forget, they think that the legislature did that to them, but voters passed that by a fair margin. But I think the one thing that they were clear at that moment was they wanted addiction services funded.
Yes, that's why they voted for it.
They didn't want to decriminalize drugs. They wanted to say that person's not a criminal. That person needs help.
Mm-hmm.
Yes.
Right?
Yep.
And here we are in last place. Okay.
Right.
Terrible.
Yeah, that's a great point. I'm glad that you raised that.
A lot of things to talk about on that front.
Okay. So next question, where does Oregon rank in terms of food stamp usage? So it's a little bit, first would be, it is the number 1 state in food stamp usage, and then 50th would be the least amount of food stamps. So I just wanted to
Do they call it
that.
food stamps anymore?
It's a SNAP program, right?
SNAP usage.
Yeah, that's right.
Okay.
SNAP usage.
So 1 is
The most.
percentage of population or...
Mm-hmm.
Okay.
Yeah.
Okay. Are you guys ready? You want me to go first?
I'm always in the middle, so.
Yeah, we're top 5 for sure. I'll say we're number 5.
Okay.
Number 3.
Okay.
Food stamp. I'm going to go with, I'll go with 7.
Okay. Well, we have, I don't know, we're going to have to do a tiebreaker because we're 6th.
Oh, okay.
Almost
But-
said 6.
Closest without going over. It's like the price is right. Diane wins. Okay.
Yeah.
According to Stacker, but then I was reading from the Oregon Tax Association that we're third. So we're
Okay, I go with the tax association.
yeah. There you go.
But really discouraging, right?
Yeah, very
It was
discouraging.
discouraging.
Yeah,
But,
yeah,
but
overall
we-
discouraging.
Yeah.
I think our attitude is to get as many people on.
Yeah.
1 in 3. We're going to cover that later, but 1 in 3 Oregonians are on some type of public assistance, not counting Medicare.
Wow.
This is a little bit random, so forgive me, but we were talking today. I had transit folks in my office talking about, needing an increased percentage of payroll tax. And I said, well, if you look back at Measure 5 and Measure 50, there's a lot of concern that when we capped property tax, that we limited the growth of that fund, which it has not, right? It hasn't limited because property value's gone up. So people are still paying that fixed percentage, but of a higher value of their property. So so revenues, property tax wise, have gone up. But interestingly, on the transit tax, because it's 0.1% of payroll and we're losing jobs and we're losing the right types of jobs, they actually need the number to grow in order to just maintain the amount of income that they had. Which is, again, it's a sad commentary. So as we've laid out over the course of the conversation about DOGE episodes, and we're saying the economy is a problem, and losing the manufacturing jobs and losing the food service and the hospitality, like losing all those jobs is problematic when you only then have government subsidized jobs, healthcare, education, or direct employment by the government.
Right.
Well, look what's happening in Portland. I mean, I think the average income is going down, right? The high income earners are leaving,
Yeah.
Right.
being replaced by lower income earners.
Yeah.
Yeah, that's a problem.
You taxed wealth in Portland and the wealth left.
Yes.
Well, you also in the rural areas, you have as they add more and more rules and regulations on agriculture, and agriculture can't survive.
Right.
So agriculture says, "I'm done." Right? They just close up shop. They can barely even sell their land. It's pitiful. So those workers that are there who have had, and the left will call them underserved and underprivileged and overworked. These folks, I know them. They're in our community. They are extremely hard workers and great family people, and they love having these jobs and these communities. Those folks are out of work also. So what do? They have to go to this to feed their families.
Right.
And so it's not going to be a big number, but it adds to that whole aspect.
But it is absolutely tough, right? Writ large, as we, as the legislature are passing things that make it harder and harder to do business, harder and harder
Right.
to employ people, you are driving people into these programs,
Right.
which then you need a broader tax base. You need more people paying into the system, but those people are leaving. So you have less and less money to provide the services. And we're going to get to this Senate, they call it labor and business. But next week, we're going to have this conversation about what they're calling that Portland doom loop,
Yeah.
right?
Economic doom loop. It absolutely is.
Yeah.
What we're doing in Oregon is unsustainable. It
Yes.
cannot continue.
And I don't mean to digress from this. I do love the game.
It's related, though.
But I hope you guys, I've been here 7 years doing this work, 5 in the House, now 2 in the Senate. This is my 3rd year in the Senate. But you pull on one string. And the reason why I want to talk about these other non-DHS topics is when you pull on one string of policy topic, it touches everything else. You can't talk about DHS without talking about the economy. We're going to talk about education and truancy and all the things that go into then this topic that touch the other topics.
Right.
Yeah.
Yeah, absolutely.
Okay, Alex, sorry.
100%.
We're back.
No, alrighty. Last question here. Let's see if Senator Linthicum can go 3 for 3.
That hurt.
Where does Oregon rank in mental health care? And 50th being the worst.
Worst.
I'm locked in.
50th.
Okay.
The worst. I'll go with 45.
Okay.
Yeah, I was going to say 50th, but I guess 49th is the next.
We might even be lower than 50th if you count Puerto Rico.
Yeah.
It's a good point.
DC.
I'm gonna have to give it to the real deal Ed Diehl over here. We're 50th, and it's that's per OPB as well.
Yeah.
So
That's access to mental health care.
yeah,
Some people don't agree with that ranking, but
yeah, not inspiring, not a good thing.
no.
Right.
And especially when you think of how much money we put at this.
Right.
Right, the budget keeps growing and growing.
Yeah.
For it.
Yeah.
So before we get to the budget, though, let's go to the next slide. Let's talk about what does DHS do?
So ODHS mission, the vision, and this is directly pulled from their website. So the vision is safety, health, and independence for all Oregonians. The mission is to help Oregonians in their own communities achieve well-being and independence through opportunities that protect, empower, respect choice, and preserve dignity. And their values are integrity, stewardship, responsibility, respect, and professionalism. And their goals are diversity, equity, inclusion, and belonging, or DEIB or DEEB.
Yeah, I do struggle with that last one, but mission of preserving dignity throughout my community. You know, one of the great groups that does a tremendous job of impacting people that are kind of in this space of needing either mental health or substance abuse treatment. The Canby Center in my district, dignity is like a core word for them, and it really does drive everything they do.
Yeah.
Their approach to people, you know, trying to connect with people in a very humane way. They're a faith-based organization, but that word dignity strikes a chord with me, right? To give somebody purpose, to give them a sense of self-worth, I find all-encompassing within dignity. The goals I struggle with, you know, I don't know ever what equity truly means.
I mean, equity, in my view, is a socialist term because it does not reflect American values. American values are equality of opportunity, right? Not equity of outcome. And so that equity in and of itself is I don't know if it's communist in origin or what the origin of that would be in terms of policy, but it is certainly not what our nation was built on. Our nation was built on equality for all, right?
Equality of opportunity. Versus
and you can make yourself into anything you want to be.
Equal outcomes.
Right.
Based on criteria that just doesn't make sense. And you see it in every one of our agency meetings. You know, you serve in human services. They're measuring everything in outcomes based on race.
Right.
And it really bugs me. They'll draw a line, and this is what they call parity. They used to call it equity. Now they call it parity because I kept giving them crap about equity. But for some reason, they'll look at how people use a certain program, and they'll divide it up by race, and they'll draw the line and say the amount that white people use is parity. So if Hispanics use it less, that's a problem. If blacks use it more, that's a problem. You go, based on what?
Yeah.
You know, so the issues are not your skin color. Some of it's cultural. Some of it, and a lot of it is economic driven, right?
Yeah.
And I feel like we lose track of what the real goal is and what the real issues are by the way we're doing some of this stuff.
Agreed.
Yeah.
Well, speaking of the stuff we're doing, let's go to the next slide and kind of walk through what it is specifically that this group's focused on.
Yeah. ODHS leadership, direct services. There's about 6 major programs: aging and people with disabilities, which is APD, child welfare or CW, developmental disabilities services, ODDS, and Oregon Eligibility Partnership, which is OEP, self-sufficiency programs, SSP, and vocational rehabilitation, which is VR. Support functions, central services include budget, human resources, tribal affairs, equity and multicultural services, immigrant and refugee advancement, Office of Resilience and Emergency Management, ODHS and OHA shared services.
So again, we pulled a couple of these slides from their annual report that you would have seen in your budget committee. Alex's role one more, kind of showcasing who we're talking about in terms of who's receiving. Go to the next slide if you would. So 1 in every 3 Oregonians receives 1 or more ODHS services, right? Kids in foster care, individuals that are working on some vocational rehab program, trying to find employment, the long-term care services, case management services. Of course, the big one down at the end, individuals receiving medical benefits, is how they balloon that number to say 1 in 3. But 1 in 6 Oregonians is receiving SNAP benefits, and then of course TANF as well. So there is significant need within the state of Oregon.
There is, but I think when I think of Medicaid, and you talk about dignity, the inherent dignity of human life, and that's something that drives me in everything I do, and especially in the building. But I think of when it comes to this program, children, the elderly, and people with intellectual and developmental disabilities, human dignity, supporting those folks who are unable to help themselves. And I think that's what Medicaid was really intended for. And unfortunately, what I see us doing is we kind of shortchange them in an attempt to take these dollars and spread them across a broader and broader population. And frankly, I think we're giving dollars to folks that don't necessarily need it. But the folks that do need it the most are getting shortchanged.
Yeah.
And when we're looking at possibly budget cuts coming, or I shouldn't say, maybe that's not the right word, cuts, but adjustments in Medicaid and how that money is going to be distributed, we're going to have to make some tough choices. And the way we've used it, we've leveraged Medicaid to the hilt more than any other state. So when there's a cut, we're going to feel the pain a lot more than other states. We're going to have to make some real tough decisions.
When the conversation first came up, Representative Nose was talking to me about, these are poor people. These are people that are struggling. And, these are real cuts that the federal government's threatening us with. And we need the provider tax. And we need these other things. Bonham, you got to help me help these people. And I asked him, I said, but Rob, have we not grown the population that we're trying to serve? Are we not trying to be everything to everybody? And not just grown the population, but grown the services that we want to provide. And I know we're not talking healthcare, we're talking human services on this case, but on the healthcare side, the procedures that we're willing to do, the things that we're willing to cover for citizen and non-citizen alike, to invest in the border of Idaho so that we can attract people from Idaho that may not have access to abortion. We're trying to bring them across the line. And so some of the challenge is the scope and the depth of which we're providing service. And it's a hard one for me when I know how much we're investing in non-citizens to see a veteran in need, to see my neighbors and friends that are needing some support, that need a hand up. And again, most people are not looking for a handout. Most people are saying, I need this temporary service to get back on my feet. I want to have the dignity of being financially independent. I don't want to have to rely on the state. And so how can you help me get to where I need to be? And DHS does provide some of those services.
Yeah. Well, we're spending money to provide abortions to people from out of state. We're spending $1 billion every 2 years to provide health insurance, free health insurance to non-U.S. citizens.
Yeah.
But yet we're not giving healthcare, mental health services to kids. One stat we missed, we're the bottom for mental health services. We're the top for youth incarceration. Wow. I think those are connected, right?
That's huge.
So we're just kind of missing the boat. We're spending a lot of money. I just don't feel like we're putting it in the right place.
Mm-hmm.
So Diane, earlier today, we were talking about, your experience with DHS, and you literally said, well, when I was staff.
Right.
Yeah.
So when I was staff for Senator Dennis Linthicum for 8 years, the largest group of folks who would call, constituents needing help with an agency, were DHS folks who were dealing with the DHS agency in their communities, in their life. And it was traumatic experiences. Like these were situations where people were quite beside themselves with how to manage what was happening in their life with their kids. A lot of times it was grandparents who were trying to do their best with children that they now had custody of, just, every situation under the sun. But I felt like I would open my email and there would be a DHS situation that I needed to then contact the agency. And to their credit, they were good about getting back to me and trying to help. But I think, every human being is so unique. Every situation where you have children involved and families and some dysfunction, whether it's mental illness or substance abuse, these are complex situations, and it takes. I often wondered when I was in the position of chief of staff, and I wonder today if the DHS folks that are on the ground in those communities, if they actually have enough training to deal with the varied amount of situations that they encounter, because they're getting more and more complex. And when you have substance abuse, if you talk to police officers, that's the toughest thing to manage, because it's a irrational thing. It's not something you can anticipate the behavior, right?
Well, our system, and they're fixing this, but it was designed. You had mental illness or you had a drug abuse problem. Well, now it's a dual diagnosis thing because of these nasty drugs we have, and the system isn't designed to handle that. Yeah. So it's a dual diagnosis situation. I think they're finally figuring out how to get it worked out, but it really makes it tough to try and get help.
It does
for folks. Mm-hmm. Plus, people aren't trained. You're trained for one or the other. Mm-hmm. Can you handle both? Mm-hmm. So,
in addition to that, you've got to deal with the legislature every year passing new law, the agency having to promulgate new rules, which is a great segue, Alex, into the next slide.
Yeah, ODHS by the numbers, 2,564 rules, which translates into 2,637 pages, which is just.
Well, how do you absorb it, right? Like, we keep coming back to these numbers. Last time, we were talking about, who was it? I don't even remember who it was.
I think it was Ty. We had the paper.
We had 16 reams of paper for DEQ that represented how does a person engaged with DHS as a provider understand, recognize, and enforce all these rules? We've got consideration right now, some different laws I think we're going to get into a little bit later, but just for an example, the 32 steps you've got to go through to decide whether or not you can restrain somebody. If you're a teacher in a school,
they're not going to figure that out.
If you're a care provider, like how do you walk through? Like, there's no way you have it memorized. No. And I briefly, like, there's a bill 3835 that's trying to just streamline that to 3. I can remember 3. I can take 3, put it on a laminated sheet and post it on the wall, and we can all refer to what are the 3 steps I've got to go through? Right. And again, I'm not saying that the 32 steps aren't thoughtful, but
we've regulated out common sense. It's like we're trying to fix the least common denominator. You got a bad actor, so you write all these rules. Well, then the good people don't know what to do.
Right.
Amen.
We have it's a behavior. I think it's a behavioral health or drug treatment center trying to open up in Portland, and they built it. They've hired all their staff. They've been waiting for 4 or 5 months now to get the final permit approval over just petty stuff like where a sink is located and crap like that.
Yeah.
And you go, how did we get here? How do we have all these rules and regulations that just get in the way of common sense and getting good things done?
So, budget in this biennium that we're closing down now is just under $20 billion. Where are we going?
A 14.2% increase to $22.5 billion in the governor's proposed budget for this next biennium.
Go to the next slide again. So this is one that I really appreciated that the young guys that are helping us out, the Doge bros.
Shout out to Ty Visner for this great little
for these charts. But you're looking at the teal color as the actual growth, and then the sage green color, since I'm sharp on my colors, would be what inflation would have done had you said, okay, 2011, 2013 budget, grow for the cost changes in society. To your point about trying to be everything to everybody, there's a wonderful visual of what it costs.
Right. And I think these things are so multifaceted because they're always coming back for more money. Look, and they bring the slide, their own slides of how many more people we're servicing, and yet, it's maddening for those of us in the legislature who recognize that it is past policy and past legislation that is causing this, right? 100%. So you pass, legalization of drugs, and what do you get? Oh, holy cow, we need more money to service the poor people whose brains are fried. I mean, this is not rocket science. This is pretty commonsensical, as you mentioned, right? We've thrown common sense out the window, but that's what it ends up to be, is then a huge budget increase, which of course then falls on the taxpayers that are, working hard, running your local, tune-up shop and working at Walmart and, trying to make a go of it and raise their families. And that's a travesty.
We legalized marijuana.
Right.
We came back a few years later and legalized drug possession. And again, I do think that the people at the time said, hey, we've got a lot of people that are on the streets, that are in our community, in society, that are using drugs, and we don't want to make them criminals. We want to get them clean and sober and give them that chance to return to productive members of society. I think that's absolutely what people wanted and meant with that vote.
Right.
What they didn't anticipate was the attraction that Oregon would become to people that wanted to be able to use drugs recreationally, and thus that population exploded.
Yeah.
Right.
Imagine. Again.
Right.
But now the dollars that are needed to treat the people, because there's so many more people that need treatment.
Yeah. Right. If there's no consequences to your behavior, we know how that is. If you've ever raised a child, right? If there's no consequences, you're in for it.
And 110 was 2020, correct? Was that the year that it was on the ballot? Because we've gone up $10 billion since that biennium as a result. So,
and more importantly, these are lives. These are lives that are destroyed.
Yeah.
And these are families that are torn apart. And that's the real heartache here.
Yeah.
And now these are combined Fed and these are general fund and Fed.
Correct.
So you got to remember, we had this surge of one-time money. COVID money.
Yeah.
Came in, and that's going away. You'd think, oh, we're going to get back down to normal. No.
Nope.
No.
Yeah.
It's continued. And the state contribution has jumped way up. Mm-hmm. So that's what I see going on too in every agency. There's no such thing as a temporary program.
Right. No.
All of these one-time programs are now being trying to be established and funded permanently. And if the feds aren't funding it anymore, then they're trying to substitute state money to keep the program going.
Yep.
And we're doing the road show right now.
Yeah.
So every destination we've been with the Ways and Means Roadshow, the co-chairs of the Ways and Means have made it very clear that we don't have the capacity to backfill federal dollars. Should there be any shift in federal policy, like we don't have the luxury to just say, okay, we've got the money, let's backfill these areas. And so there's no presupposition of where cuts may come from, but we are anticipating that the federal government's tightening their belt. We're $36.7 trillion in debt as of today. And, federal DOGE is looking for a way to at least try and remove the deficit spending that exists. And so it's realistic that we are going to have to make some tough decisions.
Right.
We don't know where the revenue forecast is coming in May. The new chief economist the governor hired to maximize what the economy can
minimize
be.
the kicker.
And minimize the kicker.
Maximize risk, I think, too.
Yeah. And, he showcased, with a bell curve, like the range of which his certainty is plus or minus $500 million. So we're playing with a swing of $1 billion of what money will be available. So it's going to be a challenge when the real raw numbers come down,
Right.
and tough decisions are going to have to be made. Alex, the next slide is going to show us like where within the agency
Breakdown. Everything of where everything is, spent.
On the federal level, they haven't decided what they're going to do with Medicaid, but when you look at the budget cut targets, they have to touch Medicaid. There's no way around it. They have to.
Yeah.
And then we have Oregon openly defying the federal government in, I think, every agency.
Yeah.
No, we're not going to comply with you in our schools. We're going to keep doing the DEI. We're going to keep boys and girls sports. We stand to lose tons of money there.
State.
Yeah, we're a sanctuary state, so we're going to lose money there. Even ODOT has DEI stuff going on.
Yeah.
And then in healthcare too, we're performing gender affirming care on kids. So we're standing to lose billions in federal fund.
Absolutely recklessly, by
Thank
the way.
God.
Yes.
Because OHSU, even in their own report, says we don't have any idea what the long-term impacts of this.
They have
hormone
no idea.
treatment. We
It's
have no
an
idea.
experiment.
Right.
They acknowledge it.
Right.
that it's an
Experimenting on
experiment.
our kids. It's disgusting.
It's child abuse.
And this is just a further breakdown to just another way of looking at the recommended budget and where everything else is going to be spent.
But $22 billion, run the math, 1.4 million Oregonians that it says it's supporting. It's 15,000 roughly. I think we ran the math earlier, Diane, about 15,000, per person that we say we're touching.
Yeah.
Now, obviously, some of those are not receiving 15,000 in benefits. So you've got a pretty big range of who's receiving what. But even still, if you compare and contrast that with like our education budget, right? Like you're almost spending as much on health and human services as you are on your entire education apparatus on a per person basis.
Right.
And as our population ages, it's going to be a bigger and bigger chunk.
And a good segue too, we're talking about federal dollars. Here's where that comes into play.
Yeah.
I think you also can't separate the Oregon's policy of providing all of the benefits that Oregonians who are taxpaying Oregonians, hardworking folks, may need to help them get through a tough spot, and we're providing that to illegal aliens as a sanctuary state. And
great point.
you just can't get away from that amount of fiscal irresponsibility that Oregon is putting on the taxpaying citizens, right?
Yeah.
Because it's coming directly out of, I've got, my daughter and her husband are raising 3 little kids and, working 3 jobs between the 2 of them to have them in private school because they're not interested in DEI being pushed on their kids.
Yeah, of course.
And, this is what they're doing. But so now they're forced to also pay for illegals who are not paying into the system. That's the point, right? It's not that we don't care for these folks, that, some of them maybe are kind of refugees and needing a sanctuary place, but to just open the doors and say, everyone's equal is inappropriate.
Yeah, the Federal Fiscal Responsibility Act of 2023, right, changed some work-related provisions of TANF and SNAP with the goal of providing greater incentives for able-bodied adults without dependents to engage in work activities.
Yeah.
Like I will say, the government has recognized what we're talking about, that to the extent that you can put people back to work, the value of that individual becoming a taxpayer as opposed to living off of the system is significant, and we should be focused on that. And so the fact that the federal government is saying that, I do think is tremendous. Now, can the state enact policy that drives that outcome successfully?
Well, here's like with TANF, here's what I see the state doing. And it's this perverse incentive that the feds have set up. So I think they want the states must ensure 50% of the TANF recipients are involved in work-related activities, at least part-time.
I don't know if people know what TANF is.
So
Temporary
assistance for needy families.
Perfect.
Yep. So it's meant, hey, let's give some financial aid to folks who get back on their feet, get back working again. So they've set up this criteria. So how does a state maximize the amount of federal money they pull down? They maximize the number of people that are on the system, and they make sure that 50% of them are working. So what the state does is they give $10 a month to people that are working, and that pads their 50% number so they can pull more money down. And the Fed said, well, $10 a month, come on. So they made it $30 a month. But it's still, to me, it's rigging the system. It's not a good use of federal dollars or state dollars.
So I wanted to show this to, for those of us that represent rural Oregon, and you can look across the state at, where are services? Where do you access services? Look at my prior House district. Wheeler County is a desert. Now I represent in the Clackamas, East Multnomah, Hood River, and the Dalles and Wasco County. So, I got a couple balloons now on the map, but again, like we've got a significant portion of our state where there just really is not access. And if you overlay this map with, Medicaid need and where, folks are struggling financially. Yeah. The resources are disproportionately in areas of the state where you actually have some affluence, and areas of the state that are struggling are under-resourced and served, which is always a frustrating thing to represent these communities, to know that there's need, and to want to offer these services to our constituents, and then see them gobbled up by the metropolitan I-5 corridor.
Right.
Yeah.
Yeah.
Or just like we were talking before, we're spending $1 billion a year on non-U.S. citizens for free health care. I could think of a lot of other places where money could go to help citizens. Mm-hmm. We're ensuring this population in the bridge plan, like between 138 to 200%, the people that were rotating in and out of private health care and public health care. And we're spending a lot of federal money on that, but that population is young and healthy. They don't necessarily need this. They're really not using that health insurance, but the state's taking that money, it's going somewhere, and it's actually, the state actually makes a little money off of that program. But again, it's federal money that's being directed toward, in my opinion, people that don't really need it. And then we have people that are in IDD, residential homes, have IDD. Those facilities, some of them are underwater.
Yeah,
their reimbursement rates are so low, they can barely pay their employees. In fact, some of them are operating at a loss month by month by month. So I don't think our priorities are lined up right in how we are spending our money.
And in fairness, Ed, that was one of my biggest beefs about the corporate practice of medicine bill, is if we're really trying to move the needle, you talk to people in my community that are struggling with access to healthcare and quality of care, and they've got a doctor that says, hey, I want to prescribe this, but you're on Medicare, you're on Medicaid. It doesn't reimburse me to the extent that I can offer you that. So, you have supplemental insurance? Now we can do it. But if you're trying to solve healthcare access, I don't think the private equity, the private investment is the area that needs the attention. Like if you're really trying to keep hospitals afloat, if you're really trying to solve some of these problems, those reimbursement rates are where we're underwater. Like we lose $17,000 per birth in my local hospital. Yeah. And, if the Medicaid to private insurance mix isn't just so, you're going to start losing services all over the state.
Yeah.
Yeah.
Mm.
Yep.
Yeah.
Alrighty. ODHS position growth. So again, pulled from their website, the Oregon Department of Human Services has positions available at all career levels across the state. The direct care workforce has been significant has seen significant growth in the past decade with 15,500 new jobs added from 2011 to 2021 and an expected addition of nearly 10,000 more new jobs within the next decade. Currently there are 26 ODHS jobs available if any of the viewers want to go get one.
Okay, see you guys. I'm ready to go.
Yeah. So just massive growth, right? Good touches with the budget and just more and more folks. But the interesting thing about the position growth and thanks to Representative Diehl for these numbers, is the DEI positions in the hirings and as part of the job growth. So ODHS, they do have an Office of Equity and Inclusion, and 49 positions that we know of. This is as of 2023. The total position costs is about $7 million, but I want to highlight that out of those 49 positions, those aren't fully accounted for because there were still budget requests and budget asks, but they want 49 positions. Currently, per biennium, the director of the office is compensated $451,000, and the lowest position that I saw on that list was the executive support specialist that receives $103,000 per biennium as well.
Yeah, to be clear, that is per biennium.
Yes. Yeah.
And some people are going to say, well, oh my gosh, out of $22 billion, I can't believe you guys are complaining about $7 million. But this is every agency has a $7, $5, $10, $30 million Department of Equity and Inclusion. And the challenge is we have talented people of all gender, all race, all ethnicity throughout the state. We don't need to pay this exorbitant amount to find talented people.
No.
Merit-based hiring practices will find a diverse population of qualified candidates, and it will happen naturally. The focus and the emphasis and the money wasted on this when we could just hire competent people. And the other thing, go back one slide for half a second. So if you look at the budget, it's 11,000 full-time equivalent positions that are built into the budget. But a lot of the programs that are being delivered through DHS are subcontracted. I mean,
a lot of it.
So the 11,000 people are just the people that actually are directly employed by the state. That doesn't include the group home people and the in-home service subcontractor and on and on and on and on. This group of different entities within the framework of DHS, this is a behemoth in terms of the actual bodies that are employed to go do this work.
Yeah.
Right. This is where DOGE goes in and says, okay, you really only need maybe 900 people to do the job, right?
Yeah, and
do the accounting, et cetera.
I think a fun project that the Doge Bros are going to have to get on is let's go through every single agency and let's add up every single position that they're paying, and I bet you we would come up with an insane number that we,
And when you talk, you pull some of these guys, mid-level managers and stuff aside, and you talk about DEI, and you talk about employee productivity. I mean, oh man, you'll get an earful. But they feel like they're helpless, that they can't really do anything about it, or they're afraid to speak up and stick their neck out because they're afraid that they're going to lose their job. So they just kind of put up with it.
So productivity is a wonderful segue into the next slide.
Yeah.
You guys, keep going.
Oh, well, the public sector unions are a problem here.
They are a problem.
And they limit
They're a problem across the board.
They limit the legislative ability to impact change.
Yep.
They limit the governor's ability to impact change. Agency directors. And the more I dig into it and look at these budgets that constantly grow, we don't really seem to be able to make any substantial change in these agencies. A lot of it points back to the public sector unions and the power and the influence they have in the legislature, and it's bad.
And of course, as they try, because they just had an audit done on their pay, right? And where DHS should be in terms of competitive pay range.
Yeah.
I haven't had a chance to dig through the whole thing, so I don't want to go too into it because I'm not super well informed on it. But, it basically suggested that the state of Oregon's underwater with those frontline health or human services workers by about $4 an hour. And so, I'm scratching the top of my head to remember the report, but it was like, we're at 24 and we should be at 28. Like that was kind of the price range. But you increase that wage. And again, we've already talked about the other economic challenges and budget challenges that are restricting the amount of money that we can send through the system. So if we're going to pay people more, then we can have less people,
Right.
which means either those people have to be more competent, more effective. And that's why I think this reality check is a fascinating bill, because
Yes.
what is something
Yeah,
that
what's
you
this
can
bill? What's this bill do?
So this bill, it came through Senate. Was it healthcare? Did it come through healthcare? I can't remember which one. My committees, they all flow together. But so currently, healthcare workers who do the in-home healthcare visits,
Yeah.
right? So they're just paid on a, I don't know, it's hourly basis or a salary. So what this bill wants is to actually, no, they're paid on a per visit basis, excuse me. And what this bill wants is the opposite. They just want them to be on some sort of a basic salary or a daily pay scale and not per visit, so that there's no accountability of how many folks that you service in a day. So it was really interesting to hear. Of course, you had the nurse who said she was hassled. She had to visit all these people and she couldn't possibly drive 2 hours from one place to the next.
Right.
But, in essence, it was the organization that she happened to be working for at the time, like, move on from that one. That one's not actually doing the job of actually servicing the clients as it should. Because appropriately, I have friends who do this very work, and they drive 2 hours to see a client. They note that it's well documented. It's they get compensated for their travel and for their hours on the road, et cetera. So this bill was a bill to codify that a home healthcare worker can say, in this day, I could only visit 2 people because of it wasn't only like for travel time or whatever. It was for maybe they had an intense case, a situation that needed more attention. But if you're doing that, there was no accountability on their time usage, basically, within the bill. It was they just get to say that they could only handle 2 people in the day or 1 person in the day. There was no accountability about the time management or, the problems with the client, et cetera. So I voted no on this bill.
And are these workers direct employees of DHS, or are they through?
I believe they must be. That must be home health staff, home health care, and home office.
Well, I know it's headed
staff.
to my committee. I'm pretty sure.
Yeah.
I'll just say this. Ran a small business for years, and I would have employees say, I can only do 4 jobs a day.
Right.
With the driving and this and that and the other, and I would hear that. And then I said, what if I give you an extra $15 per billable hour when you're in the home? And next thing you know, lo and behold, wouldn't you know it, we can get 6 to 8 jobs done in a day when you incentivize productivity.
Right.
And
Right.
this was a challenge we had in conversations over ag overtime. My community, when it comes to harvesting cherries, apples, pears in the gorge, fruit trees, we do it piecemeal. How many buckets can you pick? How many baskets can you pick? And the more productive you are, the more you get paid. And again, wouldn't you know it, that when you incentivize productivity, it drives outcomes.
Yeah.
And so I did find this bill fascinating, that we're saying, well, wait a second, the per visit is just completely unfair. And, I have not read through all the testimony to see what the arguments were, but just my personal experience in life tells me that when you incentivize behavior, you get more productive outcomes.
Get more productive outcomes.
Okay, so this next slide here is ODHS, money for nothing. So Regional Development and Innovation, HB 5024 in 2021 included an appropriation of $65 million from the general fund and $65 million other funds from ARPA, state fiscal recovery funds received by DAS, and transferred to OHA, which is under ODHS, to increase statewide capacity of licensed residential facilities serving people with behavioral health conditions. Of the $65 million in ARPA funds or funding allocated, OHA has expended $204,000 to date. But has contracted commitments for the remaining funds that it anticipates distributing prior to January 1st, 2027. Other funds expenditure limitation of $64.8 million is phased into CSL budget for the 2025-2027 biennium to facilitate these disbursements. So we just have about $65 million roughly, $64.8 million just waiting there.
Waiting there.
Yep, from the general fund, just waiting.
It takes so long to get this money out. On another related subject, I've got people who were in the Labor Day wildfires,
Yeah.
and we're still sitting on money that probably will never get distributed out. It's unbelievable. And that was 4 years ago.
Mm-hmm. It just goes to the inefficiency and, it's general fund money that is withering away.
But money for nothing. So I want to talk about agency with choice.
Yeah.
Agency with choice. So in 2023, I think it was 23, this thing came up where we have personal support workers. They go to the home. They're basically employed by the state. Mm-hmm. They go to the home. And then you have direct support professionals who are employed by provider agencies and also DSWs, which are employed directly by the person receiving the care. And so the state decided that they wanted to establish these agencies with choice, which are basically propping up some organizations that would act as the employer for these people that were directly employed by the patients they're serving, but yet paid by the state.
Sure.
And you dig into it and you listen to the testimony. This is a union takeover. It's going to provide collective bargaining rights for this population of people. And the state is going to spend $155 million to set this up and not add one staffer that's helping serve patients in their home. $155 million over 2 years and not provide any additional resources. But yet we passed it. I didn't vote for it.
Yeah.
I don't think you didn't vote for it, but
So I just want to be clear. We want to be accurate. So this is OHA. So
Right.
Under the umbrella of human services, we have
Correct.
DHS and OHA, but OHA is not under DHS. So they are two separate agencies. But when we look at the budget framework, we do have human services as a global umbrella. But in terms of the department, it is a separate deal. But
Correct.
But interesting to know. What do we have next? This was
in the news. ODHS in the news. Oregon fined $15.7 million for exceeding national payment error rates for SNAP. The Oregon Department of Human Services is committed to. Before I read this, this was the statement from the spokesman for ODHS, and he said that the Oregon Department of Human Services is committed to providing accurate, equitable, and timely eligibility determinations when people in Oregon apply for the SNAP program benefits. But just throwing money away from what bureaucratic incompetence would you say?
It's a challenge. Unfortunately for DHS, they don't make the news often for good works.
Yeah.
We're constantly seeing DHS in the news. Go ahead and flip to the next one. Even.
Yeah. Here's another one.
Yeah. This was something that that I found that I flagged for us just to look at, because this article, Richard Wexler, this was in January 21 of this year in the Oregon Capital Chronicle. He talks about, for nearly a decade, Oregon's approach to child welfare has amounted to a pathetic game of whack-a-mole, and he kind of lays out his case. And in this, when you see the amount of people, his fundamental argument here is that we're pulling kids unnecessarily out of homes. And Ed, before the show, you were talking about, one of the goals of DHS is to correct that.
And they're working on it, and they're making progress, which is commendable.
Right.
Yeah.
But we have been playing this game of, okay, we've got this lawsuit here that tells us that group homes are a problem, so we're going to overregulate group homes, and then we're going to move kids from that solution. We're going to put them into a warehouse, a hotel, and then wait, we got sued for that. Let's move them from that lawsuit settlement. Let's furnish them into an out-of-state institution. Oh my God, we're getting sued for that. Let's put them back into these warehouses. And so we are trying to find the right balance and the right mix, but fundamentally to that is the restoration and the ability to just stabilize a family when they are in crisis. And I don't think impoverishment should be a reason. It's 57% involved in neglect. So 97% of these kids were not involved in sexual abuse. 52% were not involved where there was drug abuse. 90% were not involved where there was physical abuse. The vast majority are families that are poor.
Yeah. Neglect may be they skipped a meal, or they were left at home alone for a bit. And I mean, neither of those are good, but let's figure out how to fix the problem.
Truancy, not getting to school.
Yeah. So I think what DHS is focused on now is the right thing, which is let's try, instead of pulling the kid out away from the family, let's work with the family. Let's figure out what's going on.
Right.
How can we help? Maybe the parents are struggling for this, that, or the other thing. How can we work with them? And you know what this does? It keeps the family together, and it saves the state money.
Yeah.
Yeah. And the outcomes are better.
But I go back to the word dignity.
Yes.
Right.
You give the parent an opportunity to continue to be a parent, and you give them temporary assistance that they need to weather a season. I do think a lot of that is this, and I'm not saying that there aren't people whose seasons are a lot longer than others, but the state should be there. I'm okay with my tax dollars going to help keep a family together. I much prefer that to paying exorbitant rates to put a kid in a hotel room.
Right.
Yeah.
And the supervision challenge that comes with that. And we've seen, and we're not going to get into every negative piece of press that DHS has been up against, but bad things can happen when you isolate a child in a hotel environment without super and at an extremely exorbitant cost and expense.
And sometimes our laws have gotten in the way of DHS being able to do the right thing. So
Yeah.
Any final thoughts?
Yeah.
Well, I would say the one thing that strikes me that keeps rolling through my head as I'm listening to this: nationwide, more than 1/3 of all children and more than half of Black children will be subjected to the trauma of child abuse investigation before they turn 18. And then when you go to the statistics above that say, wait, they weren't involved in sexual abuse, they weren't beaten, et cetera, et cetera. If you've ever read Ben Carson's story, we're great readers in our household. His mom was a single mom. She couldn't read. I don't know if any of you have ever read that, any of the listeners, but it's fascinating.
I just know it because you told me.
Yes. So it's a fascinating
It's a great
story.
story.
You all know who Ben Carson is. Yeah. It turns out he's a brain surgeon, right? And worked under Trump's first administration as well as the HUD secretary, but has been a presidential candidate as well, for those who don't know. But brilliant man. His mom was a single mom, worked, could not read, but she knew that reading was the ticket to prosperity for her two boys, Ben Carson being one of them. And so she always had them read, and Ben didn't know that she couldn't read, but she always had them read when they came home from school. He talks about how they had no money. They were just poor as dirt. And so he would go to school with a sandwich with just a little thin bit of jelly between, and that was his lunch. And so I think our modern idea of what we all need, a vegetable, a fruit, a milk, sure, that's wonderful. But you know what? I think in the course of human history, what's most important to children and raising children is that secure home life. And that was what was the most effective in Ben Carson and his brother's life. Was they had a mother who cared, who loved them, indiscriminately with everything that she had, and did the very best she could, and they knew that. And maybe better nutrition would have been better, but he turned out to be a brain surgeon. So I think that was just fine. Not that we don't want people to have good nutrition, but I think we go overboard in the parameters that we put on people and on families, and then call it abuse. We had a bill, I don't remember which one of my committees it was in, it must have been Human Services, that the language was something to the effect of DHS could look at a family if they were not providing adequately for their children. It was a very problematic bill. It did not get through committee, thankfully, because it was wide open for whatever anybody could imagine was not adequate.
DHS is a microcosm of what's wrong with the Oregon governmental structure. We are regulating down to the lowest common denominator. So the one-off person that has a situation that we could potentially have to deal with, we're going to treat that as if it's the norm. So we're going to over-regulate everything. We're going to try and be everything to everybody at great expense, at great cost, with intentions, right? People with big hearts that are compassionate, and they see the person in need. They want to take care of them. They want to make sure that everyone's safe and everyone's taken care of. We will shut down 4 or 5 classrooms when we have a room clear to have 4 or 5 teachers stand around one child, because no one's going to touch the child. And so we're going to put aside, 3, 4, or 5 classrooms at a time to make sure that the one child's taken care of, and at the expense of everybody else.
Yeah, it's ridiculous. And we're going to fix that this session, I think.
I hope so. There's a good bill before us that I'm fascinated by, 3835. We don't need to get too far into it, but I'm very robust conversation over the interim. All the stakeholders, some will argue not all, but again, significant amount of input from wide cross-section of people that are engaged in this space, that have come up with some recommendations, some solutions that could make this entity more efficient, more effective, and allow us to create accountability measures within that framework and structure. I'm excited to see that bill debated and get us back to, again, an opportunity to serve more people as opposed to just the lowest common denominator.
I agree. And that's why I'm co-chief on that bill. And it's about human dignity, like you were talking about, and making sure our kids get the help that they need. And unfortunately, the laws in our state have made it to where it's very difficult, if not impossible, to deliver the kind of care that we need. And you end up with kids in a hotel room, or you end up with kids in jail. And we know how to fix it. We just have to find the will to do it.
Well, and some clarity and some certainty for those providers, right?
Clarity and certainty for providers and for teachers, so they understand what the rules are. And the way I see it is, I want to assume that the teacher's trying to do the right thing and not trying to be a bad actor, but they're trying to do the right thing. And allow them to make a judgment call in situations that are really tough.
Without fearing on the back end that they'll be accused of abuse.
Yeah.
Mm-hmm.
Yeah.
Well, thank you both for coming tonight. Alex, thank you again for walking us through an important topic. And we look forward to seeing you folks next time around.
You bet.
On the Oregon D.O.G.E.
Bye.